Hi everyone, my name is Jackie Lamson.
My name is Crotty.
And we're a few of the residents at ECU Psychiatry. And to kind of get us started, we were just going to do a quick kind of speed round of cards, just so you guys get to know us a little bit better.
We have not seen these cards yet.
All right, Chris,
All right.
What is your favorite place to visit in North Carolina?
Mountains.
Okay.
Favorite hospital cafeteria food?
The Mediterranean Greek food or the orange chicken?
Okay.
Scrubs or professional clothes?
Scrubs, 100%. All right, favorite food?
Pumpkin flavored anything.
Nice.
Favorite second year rotation?
ED.
Okay.
Favorite color?
Orange.
Yeah, me too. All right.
Oh, my
Yeah.
What is your favorite part of the program?
People. All right, one thing you love about this program?
Also just the residents.
Yeah.
What was your favorite intern off-service rotation?
Between peds or inpatient, well, family medicine, yeah. All right, first word that comes to mind when you hear BHU?
Just a fun time.
Okay.
Would you describe yourself as someone who is late to bed or early to rise?
Yes. Early to rise, probably. All right, music or movies?
Music. Netflix or Hulu?
Netflix. All right, hardest part of intern year?
Hardest part is probably that initial transition from being like a med student to kind of a resident.
Okay.
Are you Apple or Android?
Apple. Hobby you love?
Playing guitar. What is your favorite sport to play?
Running.
That's a good one.
Yeah, not really. It's okay. North Carolina beach or North Carolina mountains?
Mountains.
Okay. Like 50-50 or like 100%?
Mountains.
Mountains, yeah.
100%.
100%. All right.
What would you say is the best kept secret about our program?
And the people. All right, favorite rotation intern year?
Being on the inpatient behavioral health unit.
Cool. I think I realized when we did that we share a lot of the same favorites, which is cool.
Yeah.
So welcome. Thanks for joining us.
Yeah.
We wanted to shoot this video to give you an idea of what it's like here. I know you guys don't get an opportunity to come and visit, so we wanted to try to bring our program to you. So this will be informal. We'll talk a lot about our program, the residents, and sort of what you'd experience. If at any point in time, like after the video's over, you want to get a hold of us and ask some questions, we really welcome that. So we'll start out with talking about really the area. So Greenville, raise your hand if you've been to Greenville. Okay, all right. So if you haven't been or don't know, it's between Raleigh and the coast, sort of equidistant. So it's about an hour and a half to the coast and about 4 hours to the mountains, which is nice. So easily a weekend trip for either. And I would say that we're in a rural part of North Carolina, but
Yeah.
Pitt County or Greenville is not a rural area. So we have about 91,000 in the city, and then there's 180,000 in the county. But once you move outside the county, it gets rural pretty quickly, a lot of farmland. And that sort of lends itself to our role, actually, in the program and in the hospital. So we have a really large hospital, 1,000-bed hospital. And if you're a patient in eastern North Carolina, really east of Raleigh to the coast, we are where you're going to get referred to, whether it's psych or a medical reason. So we are a level 1 trauma center and a tertiary care center, so by far the largest hospital. And if you look on a map, actually, you'll see it's like a huge catchment area. And what that sort of means, for if you haven't heard that term before, it means that patients in that large area are coming to your hospital, coming to us, coming to you. Why does that matter? It's a huge, huge benefit for us in training because we have a diverse psychopathology that we see, a diverse clientele. So we see everything under the sun. And I think actually it came to me when I was on one of our rotations in Fayetteville in the VA, when I was talking to an attending, and there was this patient presentation that we were talking about. And I said, oh yeah, I've seen that a couple times before. And the attending was shocked that I had seen it, and I hadn't realized. And I think it's because we see so many different presentations, and so we're kind of lucky in that regard. Great training, so yeah. So that's sort of like our hospital in a nutshell. Do you want to talk a little bit about maybe our BHU?
Yeah. So kind of at Vidant Medical Center, the behavioral health unit is like a 52-bed unit, and it's kind of split up into 4 different areas. So the biggest part of the unit is kind of the adult inpatient psychiatry unit. And then another kind of off to the side area we call the med psych side of that unit. usually houses more geriatric patients, as well as some of the patients that might have medical comorbidities, but it makes treating them on behavioral health a lot more fluid. And then we also have the Acute Psychiatry unit, which is more for those patients that need a higher level of care. And then something else that kind of makes our program unique is that we have a dual diagnosis unit. So that's for patients that have intellectual disability as well as mental health disorder that they need help with. So we have kind of those 4 different areas to treat patients out of, which is really nice.
Yeah, and 52 beds is a lot, so I don't know where you're coming from and what programs you've been exposed to, but that's a healthy number of patients. Again, so we have a huge catchment area, and then we have a large unit. So when you spend a good part of your first year on the behavioral health unit, you're seeing and treating a lot of patients, which is great. So that exposure is going to really help get you on your feet pretty quickly.
Yeah, and so really half of your intern year is doing inpatient psychiatry. So you spend most blocks on the Vidant Medical Center inpatient psychiatry unit, or a few blocks at the Fayetteville VA doing inpatient psychiatry over there. And then the other part of intern year is getting through some of those off-service rotations to really help build up some of your medical foundation for the rest of your training. And so just to talk a little bit about that, you do 6 different blocks of off-service rotations. I think 2 of the blocks are inpatient family med, which was your favorite rotation.
Yeah. But no shame against inpatient neuro and the other ones, so I'll let you go, but I really enjoyed them. But
I really liked inpatient neurology. So that's another block service that you do. We also do a block of outpatient neurology. There's a lot of crossover between neuro and psychiatry, so I just really enjoyed kind of getting to blend those together. And then you also get to do a block on inpatient internal medicine, and then a block doing outpatient pediatrics as well, which is usually another popular one that people enjoy doing. And you might get to work a little bit more with some of the kids that have behavioral disturbances or ADHD while you're helping them in the outpatient clinic.
Yeah, that was cool. I felt like at the end of block 1 or the first month in intern year, I remember thinking, the first month it was 95% about learning how to be a doctor, for sure. And then after all those rotations, our first year, I realized at the end I felt like a doctor, like well-grounded, well-footed as a physician. Of course, don't know everything, right? We have, 4-year residency program, but just, conducting yourself and treating patients as a physician, as a MD, DO, et cetera, like solid training. And not thrown to the wolves either. I mean, every rotation we were in, we were guided the whole way. And so this sort of graduated approach to giving us more and more autonomy and responsibility as you go along. So I was really happy with how it blended from starting from day 1, kind of feel like you don't know anything, to where you end up. And when you go and you start talking to the new interns, you realize how much you've learned in the first year, which is pretty cool.
Yeah. And I think, the program does a good job kind of making you feel supported in that way and kind of getting that medical training. It kind of stepwise as you work through the program kind of builds on your autonomy that you have. So during intern year, you might do short call a few times during a block, which is when you stay a little bit longer than everyone else. And so, you're the resident kind of in charge of managing some of the behavioral health unit issues as they arise. So it's helpful to feel a little bit more comfortable with medical problems as they come up, because you really want to have that medical training kind of first and build with the psychiatry on top of that.
Because at the end of the day, we're doctors, and you will soon be doctors, and we are just specializing in psychiatry. And so picking a program where you build that foundation as a physician, I think, is crucial, so that you can be a better psychiatrist at the end of it, right? So I was surprised how quickly intern year went. But any surprises for you intern year? Like, what sort of things did you think, like, after it was over, like, I didn't expect it to be like that, good or bad?
It definitely did go pretty fast, I would say. Yeah, time just kind of flies. Some of the days feel a little bit long, but then the weeks go by really, really fast as well. I forgot the question.
That's okay. I did too. No, joking now. So I think, like, when I was thinking back on intern year, like, surprises, I think the night before 1 July, you're like, oh, okay, here we go. It's time. I've been a doctor for a month and a half or whatever, but now, tomorrow, on July 1st, the patients that I'm going to see are not going to know that it's my first day being a doctor. And I think what was cool about our program is that it was seamless, and so we had the support from day 1. You hear horror stories from other programs where they are left out.
Mm-hmm. Yeah,
in the
that's
cold.
true.
Yeah, so that was not the case here, and I think that transition from being like brand new to being a solid resident and physician was nice and smooth, and so that was nice.
Yeah.
You're right. I think it was like some days long days, but I feel like short years. Like it goes by quickly.
Yeah.
And I think also what's cool is that when you really like the people that you're around and work with, it makes it so much better. So you're going to pick a program out there eventually, right? That's going to be where you're going to be for 4 years. So you know, we'll talk about that more later, though.
Yeah.
Right? Yeah.
I think something else that kind of surprised me was kind of just that feeling of, you know, you kind of step up in your responsibility, but you really don't feel alone.
Yeah.
So something that's really nice is, you know, everyone comes in with having like an upperclassman mentor that they can always reach out to. As well as the first few times that you do short call, you have an upperclassman that gets paired with you to help you kind of learn how to use the pager and learn how to manage unit issues and kind of see patients in the ED if you happen to go down to help out. So you get that support, you know, in person, and then you can always reach out to any of the upperclassmen. I've texted Chris, I've texted, you know, other mentors or called people when I've had questions come up, and there's always someone available to help out. And the attendings are also very approachable and are always happy to kind of walk you through a problem and help kind of guide you through your decision making. So there's just a lot of support from both the residents and the faculty, which is really nice.
I think that I agree. Like, there's no toxic environment here, which is nice. And so there's not an attending in our faculty division that I wouldn't hesitate to call at any hour of the night to ask a question, which is really cool that you have that. So we're lucky in that regard.
Yeah, yeah.
So intern year flew by for me.
Yeah, and then second year just kind of creeps up on you all of a sudden. And then there's various kind of rotations that you move through during second year as well. I know you said emergency psychiatry was probably your favorite, working in the ED.
Yeah, but I liked them all. I mean, that's the problem. And it sounds like such a bad answer, but it was true. So I just picked that at a random.
Yeah. I would say my favorite so far has probably been working on the consult psychiatry service.
Yeah.
I really like, you work closely with the medical services as well as neurology, kind of figuring out the pathology of what's going on for a patient, and you get to help with a lot of different problems from the consult side. And something else that's unique is that we also have 2 psychologists on the consult team that can help work through patients, you know, maybe coping with a new illness or kind of learning new therapy techniques as well from a consult standpoint. So I think that rotation is pretty unique and you learn a lot. So that's definitely been one of my favorites. But second year is really about doing a lot of the different specialties within psychiatry.
Yeah.
So you do the ED psychiatry, consult psychiatry, you do the dual diagnosis unit that I was talking about earlier.
Cherry Hospital.
Oh yeah.
Yeah. And then nights, we can't forget about nights. So nights meaning like you're the only psychiatrist in that 1,000-bed hospital. But don't worry, because you're going to be ready for it, right? So, and Dr. Lamson just finished nights.
I did just finish nights, yes.
But it's cool because like first year is about breadth, right? So you get that exposure in the behavioral health unit, all the off service. And then second year is when the depth begins, really when you focus in on psychiatry, and it's all of those different specialties like you talked about, or areas of psychiatry. Yeah.
And something that, you know, is nice, you know, by the time that you get to nights, you try to have a lot of that foundation already under your belt. So you already have the experience kind of staffing patients out of the emergency department and seeing patients on the consult team, and you've already spent multiple blocks on the inpatient psychiatry unit as well. So you're kind of managing all of those different issues and kind of learning how to be confident in doing that on your own. So night float is kind of like a big step, I would say, for second year. And then some of the other rotations, we do outpatient child psychiatry, and then we also have a geriatric psychiatry block where you get to work with one of the attendings at the geriatric
clinic.
Clinic, yeah.
And then also do ECT, or electric convulsive therapy, as well, which is pretty neat.
Yeah.
And if you haven't been exposed to that before, don't worry, we walk you through it here as well. So definitely gaining the skills to be a competent psychiatrist for sure in second year. And then, so we didn't tell you in the beginning, but I'm a third year.
Oh, I'm a second year.
But we'll talk more about third year in a minute. Yeah. But second year, you know, I thought it was great too. So it's hard, even those rapid fire questions like what's your favorite, it's hard. I really haven't hit a rotation that I really disliked, and I really haven't worked with people that I really disliked, which is really nice.
Yeah.
Yeah. So, food for thought.
Yeah.
Okay. And welcome back. We're still at the ECU Outpatient Clinic. And we're downstairs, and we're here to talk about third year. So actually, our year is divided up into 13 blocks. And you're going to spend most of the year, 11 or 12 blocks, here treating patients, your patients, in your own office, and that's pretty cool. But we also have other things here. We have TMS, we have Spravato, child and adolescent faculty are here and seeing their child patients as well. And we have psychology. We also have telemedicine, as you can see right here. So we are the ECU epicenter for telemedicine. Actually, our current chair was really on the vanguard of telepsychiatry for North Carolina, an award-winning psychiatrist. So the yellow dot happens to be Greenville, so those that are not really sure. Coast here, mountains here. We got a low pressure system coming in from the, I'm joking, no, but you can see this is our state. And so actually down this hall, you can sort of see right here is offices. No, we don't need to go down there, but the point with telepsychiatry here at ECU is that we can be here, and like we talked about upstairs, how rural this place is in eastern North Carolina. We can see a patient in Outer Banks, and then the next one an hour away, and the next one 3 hours away. And so rather than patients making this really long drive to us or not coming because the drive's too long, we can see them in primary care offices, a pediatrician's office, family medicine, etc. So it's really good. So we are on the leading edge of telepsychiatry, and you'll get to do that in third year because honestly about 10 to 20% right now, especially in the era of COVID, are virtual visits. But in fourth year, you'll do true telepsychiatry, so which is pretty cool.
Yeah.
Now also, and come with us sort of here. So I want to show you another area called TMS, so Transcranial Magnetic Stimulation. I'm going to leave Jackie behind because she's not allowed to see this just yet. Just joking. But let me show you. So we have our own TMS clinic in here. All right, so we bring patients in here, ones that are treatment resistant, that meet criteria, and we have our own TMS clinic. And you're going to get that TMS training in third year. So valuable training, nowhere else in the area does this, and you get to do it here at ECU Psychiatry. But let's go somewhere else. Boom. Where are we, Jackie?
So we are still currently in the outpatient clinic right now.
That's right, and behind us are a bunch of offices, which we're not going to go in yet. But these are actually where we see patients as third year. So actually one of my offices is down there. Sorry, I have one office. I don't have a bunch of offices. That's okay.
And as like more first and second year, you're not in this building quite as much, but you do come over to clinic for your didactics on Thursday afternoons, as well as any like meetings you might have with the program director or coordinator. And during second year, you do get to shadow the third years. So during certain parts of night float, when there's time, you get to come over and work with one of the third years to kind of get some of that outpatient clinic experience.
Like last week, right?
Yeah.
We were in here last week, so it's pretty cool. But I don't spend every clinical session here. So actually on Friday afternoons, I go over to the ECU main campus and help college students in their main health clinic. So that's pretty cool. And there's also the VA outpatient center that if you're chosen for that, you can go one clinical session a week and you get to treat veterans in the outpatient center. So that's pretty cool. So mixes it up, which is nice. So we have this, and then after that third year, you transition to fourth year. So fourth year, you're a senior on the behavioral health unit. You're a senior on the consult and liaison service, doing a lot of teaching. You have actually teaching electives. You do substance abuse training, senior ECT, and a lot of electives, like a lot of electives. It's really good. A lot of time for board preparation, which is perfect. And so we love and adore our PGY4s, which is great. And one day we will be PGY4s. It'll come quickly, soon enough, right? And yeah, so that's really kind of the basics of like program. We're going to show you around a little bit more though.
Yeah.
Yeah.
All right. Hi guys. So we're back upstairs in the outpatient clinic. This is part of the library where you do some of your didactics out of. And also here in clinic is where you do a lot of your orientation when you're first transitioning at the start of residency. So something you can expect as an intern right off in the beginning is kind of getting acquainted with a lot of these books. Right? So here, as an intern, you just want to take some time during orientation. I know you're filling out a lot of other paperwork, while you're getting adjusted and everything, but these are just some books that will be important at the same time, some neuroscience and whatnot, and there's a lot of overlap, and so you kind of just go through all this stuff and just make sure you know it by the time you start, really. No, just kidding, guys. We try to make the transition from being a medical student to being a resident as smooth as possible. Having mentors along the way, meeting with the program director, and getting to know the attendings and kind of the lay of the day, how the day will flow. Before you hit the ground running.
Yeah, or hit the ground. Don't worry, a lot of the resources are electronic.
Yeah.
Let's go somewhere else. Hey, welcome back everybody. Guess where we are? We're still at the outpatient clinic. But we actually can't film in the hospital this year due to COVID. I actually don't know why, I'm just saying due to COVID. But what's behind us, Jackie?
So this is the online schedule, so you can look to see whenever you're working, when you have shifts.
And actually, this is my schedule, isn't it? I think I only have to work when it's blue.
Yeah.
Actually, when's my days off?
You don't have any
Okay.
right now.
Okay.
Maybe next month.
Okay, very good. Now, obviously, we're just joking. We're just joking. But we're not. I mean, actually, you can see right here, I've got days off. But obviously, Monday through Friday. So it's a third year, Monday through Friday, typically 8 to 5 in the clinic with an hour lunch. We're just being cheeky. And you can see there's clinic calls, but we use an online schedule called MION to coordinate call schedules and work schedules, etc. But we wanted to show you that even though we're just joking around about how much blue is on there, we actually have a really good work-life balance. You want to talk about that?
Yeah, so kind of throughout the year you get 15 vacation days that you can schedule. And then everyone also, block 7 is kind of, it's called holiday block, so everyone gets 5 days off either with Christmas or with New Year's on top of the other 15 days. And then we also get education days that you can use also.
Yeah, 5 education days. And you can use those for step 3 studying or conferences, or, you know, so it's really nice. And when you compare that to other programs, this is actually a really nice benefit. So you're not shorted on time off, but then during your work days, actually we have really reasonable hours as far as a residency is concerned.
Yeah, on the inpatient behavioral health unit where you spend a lot of your time intern year, the average day is just 7:30 to 4:30, which is definitely shorter than some of our medicine colleagues. And on top of that, usually the way the schedule works on the inpatient unit is that you kind of work and then you get a golden weekend. So then you'll work 12 days and then get another like golden weekend, which would be Saturday and Sunday. And kind of as you progress through the program, you get more and more time off, I would say.
Yeah, agreed, 100%. I don't remember the last time I saw a 4th year. It's a joke. But it's true. We have a lot of balance, and wellness is really big. And so we practice what we preach. We preach that to our patients about wellness and balance, and we practice that here. So it's important.
Yeah.
Should we take them somewhere else?
Yeah.
All right, let's go. You ready? Okay. Hey everybody, welcome back. Guess where we are?
We are still in the outpatient clinic, but we are currently in Chris's office.
Yeah, this is my office. Yeah. And maybe one day this could be your office too. So we're kind of at the end of our video. We actually were thirsty. So we decided to come get a drink.
Yeah.
Cheers.
Cheers.
Cheers to ECU Psychiatry. So I would say it's difficult, right? Kind of difficult for applicants to get a feel for the programs. Would you agree?
Yeah.
It's unfortunate. We got a chance to interview face to face and see and meet the people and the places we might want to work, and then kind of make our decisions based on that. But we know you miss out. So we're trying our best, even though we're not pros at this, to bring you a sense of what it's like here, right?
Yeah.
And I don't know, I think if you pick any ACGME accredited program and match into that, you're going to get good training, and you'll likely pass the boards as the numbers stand. So then, you know, we were talking about this earlier, like, so then you really have to kind of pick a program based upon if you like it and where you fit, because 4 years is kind of a long time, right? And you kind of want to be around people that you really love to work with. Would you agree?
Yeah.
And so, like our residents, we hang out a lot outside of work.
Yeah.
So all the days that are not blue on the calendar, we like to work out.
Even some of the blue days that don't last that long.
Good point. Meet out for lunch or dinner, stuff like that. Yeah. So we are a tight-knit group, and we're not a group that is competitive among each other. We help each other out, which is really nice. So when I think we were doing the speed cards earlier, and you were telling like what's the favorite part of the program, like people, like even the behavioral health unit. So I was actually a medical student here, and I got to see this program as a medical student, as sort of a fly on the wall to see what it was like faculty, nursing teams, etc. Well before I had to make the decision, and I ranked this place top. It was an easy choice. But again, you missed out on that, right? So I think that when you pick a program, when you pick a program, really pick it based upon how well you will fit there and be happy there, because you're going to get good training. We have a lot of stellar things about our program that really separate us from the crop. I think one of the things that ECU prides itself on is making outstanding clinicians, okay? So if your goal is to do research, and you want to do research, we have plenty of opportunities here. But this is not considered a research institution, right? What we hear consistently from graduates that go and match into fellowships, etc., is that they love how strong of clinicians we are, and so that is something that, you know, we, I guess, benefit from being here. So, I guess when you pick a program, what do you think? What are some things you think?
Well, kind of like Chris was saying, I think, you know, the people that you work with kind of across the board have just been all really, really great. You know, when I came in as an intern, a lot of the nurses kind of helped take me under their wing and teach me how to do things. And, you know, I still go to them for help now as a second year and kind of, you know, get their viewpoint on how a patient is doing. And I think a lot of the people that you work with throughout the hospital are just very approachable. You know, the nurses, the other recreational therapy, occupational therapy, the attendings, in terms of giving you input. And then, you know, as residents too, I think we all just gel pretty well together. There's about 8 people per class right now. You get to work closely, especially intern year, you get to work pretty closely with your fellow interns and a few of the upperclassmen that are helping you out. And then kind of, you know, as the year goes on, you just get to work with everyone a little bit more. But I would say a lot of us hang out, you know, outside of work too. There's a lot of fun things to do in Greenville. There's a lot of food trucks a lot of the time. Some of us will just meet up after work and go get food. We have some people that are more athletically inclined that enjoy doing like run club or get together and work out and lift weights. I'm not a part of that group. We also have people that are more musically inclined. You know, I know I mentioned playing guitar. We're also coming up with like a resident holiday band that we're working on. Some people still kind of learning some of their instruments. But we try to have, you know, fun outside of work too.
So that kind of goes back to like, if you're going to be somewhere for 4 years, try your best in this sort of virtual environment to find a program that aligns with what you want and what your values are. So we hope that you consider us. We are very happy, aren't we, Jackie? Yeah. We are. We actually really are. So please feel free to reach out to us. All right? In closing. All right. I just wanted to do that transition again because it's cool. So we're still in my office. We just wanted to leave you with a closing thought, something that's really heartfelt that we want you to sort of internalize and think about. In summary, our program, we have great faculty. We also have awesome nurses and team. And we have cool residents. Plus, we are IMG friendly and we are DO friendly. We are just friendly. No, seriously, we are really friendly. Yeah, ECU Psych rocks. Hit us up. Thanks for joining. Let's do that again. Can we do that again? One more time. Welcome back, everybody. Guess where we are? We're still at the outpatient clinic. When is my days off, though?
You don't have any.
Oh, okay. Okay, good. I don't know.
That didn't work. That didn't work.
I'll show you different parts of our clinic. So what's behind us, Jackie?
So behind us right now is kind of the resident clinic schedule. Sorry. Oh my God.
She doesn't know. She doesn't. She's just a second year. So in closing, we just wanted to leave you with a cut. You're going to cut so I can talk better. Okay. Boom. Welcome back. Where are we, Jackie?
We are still in the outpatient center.
That's right. What's behind us, though? What's behind us?
I didn't know you were going to ask me anything.
Fast and loose. Okay. Coast here, mountains here. We got a low pressure system coming in from the. I'm joking, no. But you can see, I'm going to leave Jackie behind because she's not allowed to see this just yet. And ready?
No. Wait, there's a stray baby hair. I'm just going to go back. Okay. Is it okay?
Yeah, ready.
Okay.
Okay. All right. Hey, everybody. We're back. We're actually downstairs at the ECU outpatient clinic, and we're standing behind this. You want to tell them what we're looking at here?
What is it?
You know what? They've got to do their board prep, and they're involved in projects and maybe writing. So I don't really know what they do, but they're busy. You know what I mean?
Oh, ready? Wait, I'm not ready.
Back in? Back in?
My hand messed it up.
I would like all of the. I would like all the raw footage.
Okay.
Right.
Oh gosh. Okay.
Right.
Oh, hold on.
Ready?
Just kidding.
You'd be like, what's up?
Oh
Yeah.
gosh. Okay.
Yep.
Okay.
Faster than
Just
this.
losing it. I don't know when I'm asleep. Okay. Neuroscience and whatnot, and you know, there's a lot of overlap, and so you kind of just go through all this stuff and just make sure you know it by the time you start, really. No, just kidding, guys. We try to make the.
Yeah. So Jackie, what am I forgetting?
I don't know.
I'm forgetting a lot, but that's okay. Yeah, it's okay. Yeah, it's okay. It's gonna be okay. Right. But you've got to smack the camera at some point.
Oh,
right?
I forgot.
Yeah.
Okay.
We'll get to that in a second, right? So that is really going to where you're going to learn to cut, and we'll start over. Okay. Nice. We have awesome nurses and team. Okay. We also have. Was I good? Was I good?
No.
I just want to know.
Sorry, the and team is just like, it's not even that hard to say.
I struggle downstairs. Ready?
Resident schedule?
Yeah, just like this.
Scheduler?
This is our schedule. This is our schedule.
What is it? It's the website. Sorry.
The thing where we look when we have to work. You could do that.
That's really not so funny. It's just that I'm running on 4
we
hours
have to
of
look
sleep.
at where we know where to be. Like
You
when
work
we
and
have
then
to
you
be
work and
there,
then you work
and
some more.
you can see I only have to work when it's blue.
You only
I'm gonna do that.
have to work when it's blue. You should say that and then say, so when's my time off?
Can you point to my time object? All right.
You don't have any.
He's laughing, so
Okay.
it's funny. There you go. Ready?
Okay. Yeah. Sorry. Okay. Real this time. Start getting delirious.
All right.
Okay.
All right, we're done talking about second year. We're going to get up from these seats so we don't have a blood clot for them. And then we're going to walk around and show you some stuff. Sound good?
Sounds good.
Maybe. I'm just joking about the blood clots. Okay, time to go.
I like the blood.
You like blood clots?
I thought it was funny.
Yeah.
Hold on, I don't even know how I was sitting. That wasn't it.
Is this awkward? Yeah. Are we filming?
Yeah.
Good,
Oh.
good. I want this in. I want this coverage in.
I
All right.
don't know.
Now that you have heard about second year.
Wait, my stomach. I
Haunted. Name that sound
and I
for
just dropped.
$200.
Hold on, I just flung this off myself as well. So.
Oh my gosh.
Is that right? Nice.
Yeah, right. All right, so I guess we finished talking about second year, really, for the most part.
My stomach did it again. Did you hear it that time?
Someone feed
Oh,
her.
okay.
We can include bloopers, right?
I'll leave it.
Yeah.
Yeah, there can always be bloopers.
Yeah.
Full of bloopers.
Yeah. I think we're done. Fine.